Well, this is podcast number 4, Wellness in Woodford, with me, Cassie Prather, Public Health Director. But this is going to be a little bit different this time. Typically, we interview other people to talk about other public health issues. This is going to be a little bit different because I'm going to be talking about a breast cancer diagnosis, which most people know that I was diagnosed last summer with breast cancer. And so today I want to talk about, some of it will be about what to expect.
Okay.
As someone that's going through a breast cancer treatment diagnosis. And then really what to say and what not to say to someone with breast cancer.
Sure. And by the way, Corey Cooley here, What's Up Woodford Network. I have no idea. So this is going to be very interesting. And especially because last episode you mentioned that when you found out you were diagnosed, you went straight to friends and that you knew that had it to ask questions. So if possibly you don't have anybody close to you or know anybody, this could be a good resource.
Yes.
Because I think we're listening straight from somebody who is a survivor, right?
Yes.
Is that one of the,
I'm surviving.
Yeah,
That's
surviving.
what I say.
Okay.
Because you really don't ever survive it.
Sure.
And I'll get more into that later, but you're exactly right. You that's one of the things I want to emphasize most is if you do get a diagnosis of breast cancer, reach out to someone. If you don't know someone, reach out to me. I actually had lunch with someone last week that I didn't know. I knew someone in their family, but they were younger and didn't have a lot of family or friends that had experience with that. And I said, hey, a phone call won't do this. Let's meet in
Face
person
to face.
and
Absolutely. And I mean, maybe
talk about it.
Yeah, I mean, geez. Yeah, I mean, somebody outside of, like, that may actually be a comfort. Like, I kind of want to go outside of my family to talk about someone. Like, that could be a plus there.
There are a lot of emotions when it's family.
Right.
And I don't want to say that I would be less emotional,
Oh, no.
but
Yeah,
I mean,
yeah,
it kind of does make
different.
sense. Yeah, it's just a different
yeah.
conversation, more candid conversation.
Right.
And I want to start with, I did not have any family history of breast cancer whatsoever. I was 41 years old by the time I got my first mammogram, because when I was 40, that's the age when you are recommended to get your first.
It should be 30.
Yes.
Same thing with colon too. Like, that is, it's come back a decade. I feel like it needs to be earlier, but anyway.
Absolutely. I agree 100%. And I do have to say, insurances are getting more. They know that if this progresses and they don't allow someone to have a mammogram without, with the family history, that's going to cost them way more if they have that patient wait.
Yeah, of course.
Especially if they felt something. Now, that's not typically the way that you find breast cancer. The best way to find breast cancer is through a mammogram.
Right.
And typically, you can make those appointments yourself. I thought it had to be a referral situation. And so I called myself, made the appointment.
Yeah, nice.
Actually was able to do it here at Bluegrass Community Hospital with Laura. She's the radiographer.
Okay.
She's been doing this type of work for years. Made me feel very comfortable. I was originally diagnosed with one type of breast cancer. Later, after I had already gotten everything scheduled, I was scheduled for a lumpectomy, and my treatment plan was going to be to take tamoxifen. It's like estrogen, progesterone blocking hormone.
Okay.
As a medication for that. And then also do radiation. That was my treatment plan. And my oncologist called and said, there's another place that they didn't biopsy.
Okay.
That is, I don't know what it is. It doesn't not look like cancer. It also, so I don't feel comfortable.
Pump the brakes.
Yeah.
Okay.
I was so upset because, you get this diagnosis.
Sure,
the first thing you want to do. Yes, let's get it done.
Let's get this done and get me out of here.
Yes.
Yeah, let's keep moving forward. Yeah.
And there were so many other things that happened in the midst of that. And now looking back, I'm like, oh, that was meant to happen exactly like it did.
Yeah.
People were on vacation, providers and things like that. Well, sure enough, I had 2 types of breast cancer in one breast.
Wow.
And he said I wouldn't have felt it for years. And he wouldn't have recommended that I have a mammogram because of no history until 50.
Yeah. Jeez.
So here I am, I'm 1 year out.
Yeah.
I've had reconstruction surgery. My reconstruction surgery was actually coupled with my mastectomy. So some cases they can go ahead and do what they call direct to implant from your mastectomies. Some people don't choose to do that. And some people, for whatever reason, I think it has to do with a vascular issue. You have to have the blood supply to support that. Regardless, you're never going to feel the same for the rest of your life.
I mean, I can't imagine. But yeah, I mean.
So one of the things that I found that people said to me when they found out I was having a mastectomy, oh, yeah, get them cut off. You'll be fine. And
But that's to say. It's easy to say.
It's easy to say. It's super easy to say.
Part of your body.
And these are people that I love dearly.
Yeah.
And that have supported me through and through.
I wonder if they're just saying that just to be like, to keep you at ease. Be like,
100%.
And get yourself some, Get
it was a
yourself
pep
some
talk.
What is it?
Get
yourself
some new ones. Yes, absolutely.
New models. That's why.
Yes, exactly.
I can see that. Yeah.
And really, it is great that you have that option.
Right.
But it still doesn't alleviate the fact that you have cancer. You are having to make this decision.
Right.
Even though you don't want to.
Right.
And implants that are placed because of a bilateral mastectomy aren't your typical implants. And so they are saline implants, and they have to use that for a specific reason. However, it's different.
Yeah.
And I think a lot of people really aren't told that before. Because a lot of your care team is going to be very, positive.
Sure.
And they want to support you and make you feel at ease, all those things.
Which is totally great, I mean.
It is.
Awesome. But, that's why we have surviving people like you to like, okay, like I know the doctors are saying this. My family's saying this. I feel one way from one person to another that's experienced it. Is this weird that I'm feeling this way? You know what I mean? Yes. And then you can easily make them feel at ease, I think, with your expertise and knowledge.
Well, yes. And so I had a bilateral mastectomy, and I did that because if you have breast cancer, the second cancer that you have more chances of getting is another breast cancer.
Okay.
Then you're also increased, like if you don't have a double mastectomy, things can metastasize and spread throughout your body. And so cervical, those types of cancer are more common. So that's why I opted for, okay, let's just do the most aggressive thing.
Right.
And I feel more comfortable with that.
Yeah, sure. Yeah.
However, I was really, from my diagnosis until probably 6 months after my surgery, I was kind of just going through the motions. I had never really truly processed what had happened.
Right.
I still have to go to the oncologist.
Sure. Yeah.
And that's weird for me. I'll share a funny story. I sat down in the waiting room one day, and of course I had been at the office that morning, so I was, dressed in workwear, and I sit down with my purse, and there's a gentleman sitting down beside me, and it's general oncology. It's not breast oncology.
Okay.
But the gentleman that was sitting to my left gets up and comes to shake my hand and says, "I'm with X pharmaceutical company. Who are you with?"
Because you were dressed up, and he thought you maybe, and he's thinking like, "Oh, here's my competition."
Yes. I'm like, "Hi, my name's Cassie Prather, and I'm a patient here."
Yeah.
And I think it made him feel bad. That was not my intent.
Yeah.
But I think it made him realize, gosh, cancer can affect so many people, no matter your age, race, all the things.
Yeah, exactly.
So I chuckled about it, and he was like, I'm sorry. And he said, kind of like you did, he was like, the way you were dressed and carrying yourself, I thought you, and he said, I'm really sorry. So, but anyway, I always share that story because
I don't know. I would never. I don't know. I guess he really wanted to know.
Yeah.
Whatever. I mean, good on him. He's pretty brave to. Because if you had been, you'd be like, wouldn't you like to know?
Right. I'm not sharing that with you.
I got the good stuff.
Yes, exactly. Yeah, I'm going to beat you in prescriptions per month.
Yeah.
Just so you know. No, but I think even like the nurse and the receptionist kind of chuckled, and they were like, I wish we could have told him. And I was like, it really doesn't bother me.
Yeah.
I'm past that part of it bothering.
Sure. Okay.
But, I was at the oncologist last week. I'm still having follow-up tests.
Cool.
That's why I say surviving.
Right.
Because, yes, I survived breast cancer surgery.
Okay.
I'm still surviving breast cancer.
Got it.
And so that's one of the things, because after you have your surgery, no one else will really ask you, how are you doing?
Oh, okay. Yeah.
And 6 months to a year down the road, you're struggling again. And my oncologist told me, I said, I've really been weepy and feel sad. And
sure. Oh my gosh.
Kind of like
postpartum type stuff. I mean, you're
It's
losing a body.
exactly like
I mean,
that.
you're losing. Yeah.
You're right. When I go into a doctor's office, if I have to go into the hospital, they put a bracelet on me, much like your hospital bracelet.
Sure, yeah.
And it says amputee.
Wow.
Because everything in my left side on my chest wall was taken, and lymph nodes in my arm, axillary area were taken, 3. And that still causes pain. It still causes swelling, and it will never go away.
Eish.
And so it's weird to look down at your arm and see a bracelet that says amputee on it.
Oh, gosh. Wow.
And you can't let anybody give you blood or take a blood pressure from that side. They say that lasts for about 10 years, and then your blood supply should catch up and reroute. But for right now, that's what we got to do.
Wow.
So I want to close part of this. I think I've said the majority of the things that I wanted to get across today. Yeah. But have you ever heard the saying, don't look a gift horse in the mouth?
Oh, of course, yes.
When somebody says, how can I help? I want to help. Let them do it. They're not saying that just because, it sounds good. They really want to help.
Right.
So if it's taking a kid to, a soccer game or whatever.
Kroger visit.
Yeah.
That's the big, I know my mom always used to do that. Like, that was the first thing she would always offer up, I feel like, would be like, do you need anything? Yes. Groceries? Do you need some food?
Yes.
We bring you something already made that way you don't have to do. Like, that's my first go-to, because I just that's what mom did.
That is actually several people did that for us. They just put groceries on our front porch.
Yeah.
Or they would say,
exactly,
we're bringing dinner tonight. What would you all like? Taco, spaghetti, or,
cool,
pizza. And then it's much easier to say,
filet mignon?
Yeah, exactly.
Well, let me just go back to Kroger.
Can we get to go from Tony's? I'm really craving their macaroni and cheese.
Okay, I'll be back.
So, maybe not do that unless they offer.
Right.
Then if they offer, you're full. You're good.
Yes.
But yeah, when someone asks if they can help,
100%.
absolutely take that on. They wouldn't be asking if they didn't want to do it. And again, this goes for family and friends. Mm-hmm. They may say what doesn't really feel good to you, and that's normal. And you can always just say, hey, I know it's coming from a good place, and you mean that well, and you support me 100 times over, and that's fine.
Right.
But when you say that, it makes me feel this way.
Sure.
Because that person wouldn't say it if their intent is not to make you feel bad.
No, not at all. Yeah, but I can see where it's like I really appreciate that.
Yep.
And I love that, but I'm good, thank you.
Yes.
Because I would never be able to, I unless I couldn't physically move. It would be hard for me to accept.
Yes.
Help.
Yes.
So yeah, that's
why
cool.
you
That's
gotta
a good
just
other
say,
side of it. Yeah.
hey, I'll do this, and this. And
Hey, you just want to hang out? Like that would be great. Like,
yeah,
I can't move. I'm in here. Like,
yes.
so like, there's lots of different ways. That's probably what I'd be like, hey, just let's
Come hang out.
come hang out.
Let's not talk about what I just went through.
I don't want to talk about that.
Yeah.
Yeah.
I had friends that did that. It was awesome because I was so lonely during the day.
Right. Yeah.
After you're over a mastectomy, bilateral mastectomy is, quite a bit of recovery. But you have to sit down a lot. You can't use your arms. You don't have the muscle control you had.
Oh yeah. So how is it like right after it's done? Yeah. What are some limitations and stuff that you went through?
So I drove myself like a couple days before my mastectomy.
Mm-hmm.
I drove to Georgetown to purchase and pick up a lift chair.
Oh.
So all you have to do is touch the side to be seated, recline, almost flat, and then also to lift you up because it's very difficult to push yourself up, pull yourself up. You can't use your arms,
right?
Yeah, it's
just sore and painful.
It feels like someone it's not necessarily a pain, it's a very intense pull, and it feels like those workout bands.
Yes,
feels like somebody has got like 10 of those on your
that's
chest.
your tendons. That's your muscle. It's
like they're pulling them around your chest.
That's only time will heal something like that. So,
exactly.
And that's cool that you had the foresight to grab that chair, because you probably slept and ate in that chair.
Yes.
It's like, I don't want to move.
I was in it for even longer than I thought that I would be.
Yeah.
And now I lend it out to people that are
nice.
going through that.
Yeah.
Or,
oh man, it's a game changer.
It is, because how many surgeries do you have? Abdominal surgeries, where it is really difficult for you to, sit up and use your stomach. Really, that's the core of everything.
You don't realize how much muscles it takes and that could be one of the biggest shocks.
Yes.
Gosh, yeah. I mean, I can see where that can easily compound and snowball, and you're just like, you're just
yes,
feeling it. You're going through it, and
yes,
and to have somebody that has gone through it, maybe, because I'm sure there's not any way to fully prepare.
No.
Like you can talk till you're blue in the face and do but there's just no way to 100% prepare for it.
Nope.
You just got to have great people around you.
Yes, that is key. Because it doesn't matter how educated you are about it. I mean, you could be a physician. Exactly. Actually, the physician, my breast surgeon, had gone through breast cancer. She was a survivor or surviving breast cancer. And so I had heard that, but I'd also heard that she didn't like to talk about it. Mm-hmm. And that for me, when Breast Cancer Awareness Month started, I was at that point.
Right. Like, I don't want to talk about it.
Yes. I've gotten much better because I went through it for a reason.
Right.
And I want to share everything that I've thought and felt in hopes that it will help someone else.
Very noble and a testament to you and everything else that you do for Woodford County. But, but if you don't feel like that, don't feel bad.
Exactly.
Yeah.
It's all normal.
Right.
And you may go through something that no one's ever talked about. It's still normal. Mm-hmm. And you actually brought up postpartum depression. I swear there has to be like some kind of post-mastectomy depression, because you do go through this just all kinds of emotions and hormones. And, I did take the tamoxifen, which can wreak havoc on your body. It's one of those medicines. It's a pill, but it does wreak havoc on your body and your hormones. I was able to stop taking it. It made your joints ache all the time. You felt like you had the flu. Ugh. Even though I was taking it up until the day I had surgery and was able to quit, it stayed in my body for months.
Oh gosh.
And so I was not expecting that. I thought I was going to be the one that didn't have any symptoms, but again, that is time limited. And the effects from the mastectomy can go on. And that the doctor told me when I came in this week, or I'm sorry, it was last week. They told me this can be very normal to have kind of like a post-dated
lingering.
Yes.
I mean, you're getting rid of parts. I mean, yeah, and I've been guilty of it, where I've said like, oh, that's great. Oh,
Yeah.
well then, so if you cut them off, you shouldn't get it back, right? And it's like,
Yeah.
oh yeah, like that. Like now that you say that, it's like, God, that's the most insensitive freaking thing.
But you
to say
don't
in the world.
know that.
Right. And from your perspective, it's like they don't know that, and that'd be if you have that great attitude about it, that it's like, okay, well, they just don't know, and they're trying to make me feel better.
Yeah.
That's that's fantastic, because you got idiots like me that's the only way I know how to. And then that's a part of you're a woman.
Yeah.
Like that is a part that you've had. That's whether you like it or not. I mean, that is use the term. I don't know. That is a part of your body, and it is something that symbolizes one of the things that symbolize. I feel like, and I'm not speaking for women. I'm a dumb dude, but symbolize womanhood. I mean, you're a woman, and that's something that you have, and it's been a part of you. I mean, and it's gone. So yeah, I mean, I'm wow, yeah.
Well, I think I'm going to take this a little bit in another direction, because I want to add on to what you just said. It is part of womanhood, but it's also part of your sexual health.
Mm-hmm.
And some, your identity as a woman.
Right.
You're never going to look or feel the same.
Right.
And so it does affect, it kind of has a rippling effect.
Oh, sure.
And so I just want to say, though, if you're that person and you have said things, don't feel bad, because the person on the other end of it knew that you meant well.
Right.
100%. They knew that you meant well, but you may have caught them in a moment where it kind of hit different.
Mm-hmm.
And again, they mean no harm. They mean nothing but love and support. But these are just some things that I went through. There are also the people that say nothing at all. They're so uncomfortable with it, they don't want to say anything.
Yeah. I mean, I can see that too. I mean, it's like, what do I even say? Like, I mean, there's really, when I lost my mom, people, that's literally, I don't know what to say. I'm like, there's just no words.
Nothing.
You can say anything. There's just not anything you can say that could. There's just no words.
Nope.
That's about it. That was the best response that I could think of, because I also feel, you also feel kind of like someone comes to you like, what do you say? Like, you can't sit there and go, I'm deeply depressed and everything around me is melting. I don't, this is horrible. What is this life? You don't want to say that to people.
Right.
Like, so it's like so awkward. So I'm like, we're getting through it. We're doing good. We're doing well. I'm just trying to empathize a little bit.
Absolutely.
So that is the best back and forth I feel like I got. Like,
yes.
It's like, hey, you're right, dude. There's nothing.
Did you have anybody say, oh, she's in a better place?
Oh, yeah. Oh, absolutely. Yeah.
And I want to
100%.
be like, nope, she's not here.
Right.
That's the better place.
Yeah. And you're angry and yeah, like I want to be, yes. And you're spiritual, you're not spiritual. Whatever you do is all good. But yeah, I did get that response. And obviously, and that what goes back earlier, I'd be like, you're right, 100%. And in my head, I'm like, but I wish I'm selfish, and I wish she was here with me. Yeah.
I think sometimes if you're not like,
I
I'm a
never put anybody
hugger.
down. Oh, I'm a
no,
hugger,
that's not what this. Definitely,
Yeah.
it's just kind of making people more aware of what they're saying
It's so
and how
weird,
they can
so
support.
Awkward. It's just the whole back and forth. It's just we're just human beings, man,
Yes.
trying to talk to each other,
trying to make each other feel better.
Right.
Sometimes I just want. There are a lot of people that would just come up to me and still do. They just hug me.
Yeah. Oh, I'm a hugger. Yeah.
And I'm like, bring it in. I am right here for it.
I'll
And
give
you know what? I can't even feel my chest, so
Oh.
it's fine.
Chest bump.
Yeah, you can't feel it
Yeah.
at all.
That's crazy.
There's no nerve, endings in there anymore.
Yeah.
That's gone.
Wow.
So yeah, you're like, maybe don't squeeze
See,
too
I didn't even think about
tight.
that.
Nope.
Oh yeah, man.
Stops about right here.
Yeah.
Yeah, it just maybe
And you're
6
about
inches
I
down.
was trying to say from your yeah.
Yes.
Right?
So
Am I saying it? Clavicle?
exactly, that's
Okay.
exactly
Collarbone?
what that is. Yeah. So I say all these things. This is my experience.
Right.
I'm in no way, shape, or form wanting to, hurt anyone's feelings or say what you said sucked. I didn't mean it that way.
Oh, not at all.
I'm just saying, moving forward, here's some different ways to support people.
Sure.
And it may be really what they need. Because a lot of people say a lot of things, and you never know how it's going to be received. Right. So there are some, I guess, safer ways to support people, and some more sincere. Again, I don't want to question anyone's sincerity. I mean, even my parents, they're like, "Oh, you're fine."
Well,
knock the dust off. Yeah,
that's what my parents probably. Yeah.
Are you dead? Thing. Okay, then get up.
Yeah, exactly.
Yes.
Oh my gosh, it's just like
my dad was in the military, and it's like, I mean, if a bone wasn't like sticking out or something, you were fine.
It's like, come on, like I've seen this and that. It's like, yeah, I know, but I'm the one experiencing this.
Yeah. This hurts.
Oh gosh, that sounds so familiar.
I'd be sick, fever in the bed when I was a kid. Yep. He'd be like, "Get up, you're going to school." I'm like, "I'm sick." He's like, "You're gonna be sick at school too."
Can you read?
Yeah.
Can you walk?
Yeah.
Well, I and to my mom's defense, I lied a lot about being sick when I was little because I did not like going to school when I was little. That changed later on when I got a little bit older, but yeah, I was like, so she kind of was like, "Are you like okay?" No, she'd go, "All right, I'm gonna take you to the doctor, and if they say you're not sick, you're getting it." And it wouldn't be too. It's like, okay, and then I'm thinking like, how long do I have to wait before I say, I think I'm feeling a little better?
Exactly.
Like, like, please God, don't
I'm gonna go in here and play on the Nintendo or something.
Oh, exactly. It's like you can't play video games. Like I can't. I'm sick. I'm not dying. I can play video games. Nope. Lay down. Use my
rest. Here to press the controller.
You get Sprite and crackers.
Yes. The essentials.
So being home isn't going to be cool. So I'm just going to go to school.
Just take it. Oh, I had a lamp by my bedside table, and I would turn it on, and I would put the thermometer up to it.
Oh, yeah.
Instant fever.
Yeah.
Yeah, and then sometimes it would go like automatically to high. So I would have to like wait.
Yeah.
Reset it.
You need to go to the hospital. You have 110 times.
I didn't want to overdo it.
You're smart though. Can't overdo it. See, I'd be the guy to be like, I'd be stupid.
My mom's gonna lose.
Put water in my face.
Yeah.
Get your heart rate up.
Got the cold sweats.
Yeah. I got the cold sweats, Ma.
Yes. So all the things to not do or to do when you're sick or have a diagnosis. Yes, we encapsulate. Like we just.
Yeah, I mean, I told my daughter Avery, I was like, boy who cried wolf. I was the boy. Like, I did that, and when I was really sick or when I really did have a situation where I needed somebody, they'd go, okay.
Yes.
Whatever.
Yes.
So I'm like, never, always tell the truth.
Absolutely.
But yeah.
Absolutely.
Yeah.
Well, this has been a good chat.
It's been a great chat. I'm educated. I feel more than I was, so awesome. Thank you for that. And
so welcome. Thank you for your time.
Yeah, no, thank you for having the bravery to be able to sit here and tell your story, because I know no matter how much you say it, I know it can't be 100% easy. So,
it isn't, but the more I do speak out, the more it's really for everyone else.
Yes.
And if one person today maybe changes how they approach someone who's battling cancer, or if they would just get a mammogram.
Right.
Again, that's the best way to detect one person. It's worth it.
100%. Thank you, ma'am.
Thank you.
Bye, everybody.
Bye.